Now, the reason why I say this is because most women who have PCOS, their periods are irregular. Even if your periods are not irregular, it's a possibility that you're not ovulating. And when it comes to ovulation, it's important, especially for women who want to conceive, and you have irregular periods or you have a diagnosis of PCOS, you can always purchase an ovulation kit. They sell them on Amazon, they sell them on Walmart, and you can pretty much see if you're ovulating on your own. But it's always best to follow up with your gynecologist so that they can actually do the appropriate tests that they need to do to find out if you're ovulating or not. Now, for the women who have the heavy menstruals, birth control will be an option for you to try to reduce that, because most women who have heavy menstruals are pretty much anemic. A hormonal birth control that can help stop you from having the menstrual period, where you can build back up your hemoglobin level. But again, this is something that needs to be spoken about with your gynecologist. This is just me giving you information so that you can have the pertinent questions that you need to ask whenever you do go see your gynecologist if you do have any of these concerns. Now, for the women who have PCOS, or you don't know you have PCOS, and if your period don't come and it's irregular and you go 3, 4, 5 months without a period, one thing you can use that's over the counter, you can get it at Amazon, you can also get it at Walmart. Ovacetol helps bring down your menstrual period. It doesn't bring it down right away, but it does bring it down. That first time the period comes down, it is going to be very irregular, but you will bleed, and you're going to bleed for extra days. Now, just because you're bleeding doesn't mean that you're ovulating, so please don't mix the two together. You're taking a supplement to shed your uterine lining. Ovulation happens in the ovaries, and if you are PCOS, you may need help in order for that to happen. Please take into consideration that this is why gynecologists are in place, these specialists, so that they can help you on your pregnancy journey if this is something that you are trying to accomplish. If you want to minimize your symptoms, weight loss is always the number one key. Any provider you go to is going to tell you if you lose a little bit of weight that you may see that your hormones stabilize and normalize. I just feel like more awareness is needed, because a lot of women, especially African American women, are suffering from PCOS and they don't know. And if you feel like this may be you, please follow up with your gynecologist.